To Isabel and Brian from Flanders. The floor is
Hi,
yours.
good morning, everybody. Nice being here. I'm going to very shortly introduce the region to you and then hand over the word to Brian or Jana, depending on the time, to explain the challenge. So I'm Director Innovation and Strategy at Medvia, which is a Flemish ecosystem, and Flanders is the northern part of Belgium. We are actually a not-for-profit organization focused on what we call the 4Ds, which are digital, diagnostics, devices, and drugs. We are a public-private partnership with 115 members where we try to actually include all the players of the healthcare value chain, which are, of course, the companies, but also academics, hospitals, and so on. And what we try to do as an ecosystem is to support healthcare innovations originating from Flanders, to support them in helping them thrive nationally, internationally, by giving funding. HealthChain is an example of that, but also by trying to share a lot of expertise and our network with the companies and other stakeholders in the healthcare chain. But enough about Medvia, and let's now switch to Brian or Jana from AZ Groeninge, one of the most innovative hospitals in Flanders, to explain their challenge.
Yeah, next slide, please. Yeah, so I'm Brian, and my colleague Jana is also in the call. Maybe she can turn her camera on as well. Both of us are responsible for the project within our hospital. My background is more innovation management, and that from Jana is management in healthcare. And we have a current problem within our hospital that we see with our patients, more precisely on the pediatric ward, where we see an increase of obesity with our younger patients in the hospital. So that's our current problem, that 5.8% of the children are getting obese. And we want to challenge that problem with a self-care system where the patient gets a monitor and an application. It's an application with gamification where the child gets motivated to do more physical activity outside of the hospital. And that the data can go through to the clinician so that the clinician can measure the physical activity of the child and adapt his report about the child. That's in a nutshell our problem and our solution. Also on the website of HealthChain, our full document will be available with our whole problem situation and our expected solution, and also the KPIs that we want to meet. If you have any questions, you always can reach out to me and my colleague Jana afterwards. Thank you.